attending today's webinar on stress in healthcare staff. First thing that I want to talk about is some of the things that we know about stress that are specific to healthcare. There's not a lot of research on the different disciplines that work within healthcare. And so I don't want anybody to think that we're ignoring the RTs, the OTs, the physicians, and all of the support staff and other healthcare workers and aides that work in the setting. But the research that we do have really does apply probably across the board to many of the different disciplines. However, they've largely been done by nursing groups. So we do know that working in a healthcare setting is stressful, and there are unique types of stress. And in fact, in 2015, the Manitoba Nurses Union found that over half of their nurses had been exposed to a critical incident while working that resulted in a psychological injury. That over half of nurses reported physically being assaulted at work. And what was interesting about this is that it just wasn't by family and patients, but also by coworkers. 3/4 of nurses reported being exposed to verbal abuse. And again, it was not just by family and patients, but also by coworkers. 71% of nurses in the survey said that the organizational stressors working in the environment contributed to their feelings of burnout and stress. In 2018, we have a UK study that focused just specifically on emergency room nurses. And what they found was that these were the most identified causes of stress: the work demands and lack of time, lack of managerial support, patient aggression and violence, and staff exposure to traumatic events. But what these two studies have in common is, in fact, the impact of the stress, the effects on the individuals, which was burnout, compassion fatigue, somatic complaints or physical ailments, mental health problems, and difficulty in life outside of work. So we know that healthcare workers, they have a life outside of work, and they have stresses that go beyond the workplace. We know that the most common causes of stresses outside the workplace are listed here. And every 5 years, we do a survey as to what's causing stresses. And what we know is that the top 10 stay pretty consistent. It really is the ranking that the top 10 move up and down in. So take a look at the money work economy, family relationships, our responsibilities and relationships, personal health, housing costs, job stability, family health problems, and personal safety. That's what's going on in your non-professional world that can also impact you in your professional world. Now, if we did a presentation inviting people to talk about anxiety, depression, PTSD, a large number of people would say, I don't relate to that. A large number of people would say, I don't want to be seen going to that because there's a stigma attached with talking about mental health and mental health diagnosis. But one of the things that we can actually talk about safely is this thing called stress. We talk about it openly. We talk about what causes stress. We talk about when we're stressed. And in fact, what we've come to realize is that unaddressed stress, the buildup of stress, is highly correlated with the development of depression, anxiety, PTSD, and other health-related issues that we'll talk about a little bit later. So if we talk about stress and what it is and what to do about it, I actually think that it can help people be prepared and stay healthier. So while we all have stress and we can pretty readily identify what causes our stress, very few people can actually give me a definition of it. So here's the definition of stress. It is a state of physical, cognitive, and emotional arousal. When our body is faced with some sort of adversity, threat, challenge, it activates the stress response, which is the fight, flight, or freeze response. It does this by sending chemical messengers, such as a stress hormone called cortisol, that activates our sympathetic nervous system. It's like revving the engine in order to fight or flight the adversity or danger. What it does is it activates sending energy to our large muscle groups. It increases our respiration and our heart rate. And what it does is shuts down some of the components of our body, the systems that are sort of wasting energy. So if we have food in our gut and we're in the middle of a danger or some sort of adversity, our body's going to shut down the digestive system in order to send that energy where it's needed, which is to the large muscle groups in order to fight or flight. So that's why we often feel some stomach upset. It shuts down libido. It shuts down all sorts of wasted energy that we don't need if we don't survive what we're going through. What changes next is how we think. The stress hormone, specifically cortisol, changes how our brain works. And it actually starts to dampen down and shut off our frontal lobe. And the frontal lobe is really key for problem solving, organizing, sequencing, understanding consequences, amongst other things. The next thing it does is it really ramps up the sensitivity to a part of our brain called the amygdala. And the amygdala is the emotional relay station. That's the thing that's on guard, sensing those adversities and those dangers. And when that amygdala, is more sensitive, we start to perceive more emotionality. Now, once we have that stress response, it starts to show in our body specific ways. And we call these the 5 domains. So when we have that stress reaction, physically things change, cognitively and emotionally things change. We see in our body these changes. So physically, stress is dehydrating. In fact, it puts a lot of pressure on things like our kidneys, and we start to get a dry mouth, and we start to sort of experience a sense of dehydration. That sending all this energy into large muscle groups in order to fight flight is expending a lot of energy, and it's tiring, so we feel fatigued. We want our heart rate to pump real hard or really fast in order to make sure that we get that blood and oxygen to those muscles that we might have to activate. So we have this change in heart rate. Now, this perceptual change and change in thinking, it causes our brain to use a lot of energy to be focused. And so we can experience that as sort of one of those tension or stress headaches. I also mentioned that it changes sort of how our gut's working on processing the food we might have in our stomach. So we can sort of feel that stomach upset or that nausea. And because we're burning hot, we might experience sort of a sense of sweating, not in relation to the environment, but to what's going on in our body. So psychogenic means not related to the environment. From a thinking point of view, when we're stressed, we know that it's difficult to concentrate, that in fact there's another chemical that goes through our brain that makes it hard to form memories, that we, as I said, because of the frontal lobe being sort of dampened down, it's hard to make decisions. But because our brain is sort of highly attuned, we start to be sensitive to maybe light or sound or even touch. So acute sensory distortions. I already mentioned the emotional aspect with that amygdala sort of heightened sensitivity. We start to sort of see where we cycle in and out of anger, irritability, sadness, grief, guilt, fear, and anxiety. And it's not usually one emotion, it's probably several of them over a different time, just because we're sort of heightened sensitivity. And the example I'd give you is that the amygdala is sort of like a smoke detector, sitting there passively in the environment, picking up on what's going on. And a smoke detector, we really want it to go off when there's smoke from a fire happening. But if we cranked up the sensitivity of that smoke alarm, imagine if it went off when we were making toast. How annoying that would be. Well, that's really what the heightened sensitivity is of what happens to the amygdala. It starts going off and sending messages to sort of lower threshold events. From a behavioral point of view, once our physical, cognitive, and emotional changes start to happen, we start to cope with certain behaviors. We start to avoid the source of our stress, or we start to avoid such that we don't feel these impacts of stress. We start doing impulsive behaviors or risk-taking, which is sort of like a distraction from what's going on either in our body or causing us stress. And about 50% of the people sleep way too much in response to stress, or they can't sleep at all. We see people starting to withdraw from relationships or being around other people. And at work, we often see people that might be, normally sitting in a group for lunch, suddenly going off on their own and wanting to be more alone, withdrawn. We see more difficulty in relationships, not only at home or at work. This largely has to do with that emotional sensitivity, maybe that irritability or that sense of shame or whatever it is. But we see relationships change, and we see people stopping doing what they normally enjoyed or found pleasurable. From a spiritual sense, One of the signs and symptoms of stress is that we start to change our relationship and our view of the world. We start to really ask these large, more existential questions like why, what does it all mean? How could that happen? Now, if you are part of a faith-based or a religion group, we start to see people withdraw from it and sort of question either their God or their beliefs. We call this that existential angst. So these are the most common signs and symptoms of stress. They're the most common, but they are not by any means the only ones. So why do we have these stress reactions? Well, they help us survive. They protect us. As I said, they are there to generate this fight or flight response. And our whole physiology, emotions, and thinking changes in order to more rapidly react as the danger or the situation changes around us so that we can actually survive. And our brain does what it does, shuts off the frontal lobe, sort of dampens down some of the activity so that we can stay focused without being distracted on the adversity or danger at hand. So when is stress bad? Well, Robert Sapolsky, he's from Stanford University, and he's dedicated his whole career to looking at how stress impacts all sorts of different animals on our planet. And he's written a book called Why Zebras Don't Get Ulcers. And if you either Google this on or search this on YouTube or on Netflix, you're going to find videos that he's put on. He's quite an entertaining scientist. He's got a good sense of humor, and he speaks in terms that are really understandable. But here's the key message. Stress is really a reaction that's made to be short term, after which either the danger is over or the organism is over. However, in humans, what we've done is we've taken what's supposed to be a short-term response to get away from danger, and we've actually just turned it on and left it on. And our body is constantly releasing these stress hormones as if there's a danger, as if there's adversity. So the example that he gives is that if you were a zebra on the plains in Africa with your head down, eating grass, and there was a flicker in the grass, and you thought that it was a lion, cheetah, or leopard, you would quickly activate your stress response. It would activate your large muscle group so that you could run about 300 meters away, and then quickly put your head down and start eating grass again. It's a short-term response to the adversity to get away from it. But as I said, in humans, we don't do that. We use this system that's meant for this short-term response, and we use it chronically. And that's the dangerous part of stress. It becomes cumulative, it piles up, it becomes unresolved. And over time, what we see that it changes people's physical and mental health. We see performance start to decline, relationships start to break down, both at work and at home. And we see people are described as just being different. There's a personality change. With regards to the physical health, we have a lot of research now that highly correlates this cumulative or chronic stress to such things as diabetes, heart disease, stroke, fibromyalgia, and chronic pain, amongst others. So what we actually have is definitively, we can say that stress is killing us. Now, of all the slides that I hope that you will remember or pay attention to, it's this one that's in front of you. This is the real takeaway message. So this slide represents what a researcher in the 1940s and 50s found. His name was Hans Selye. An interesting fact, he was from McGill. So stress was first defined and or described by Hans Selye, and he was pretty much the first person to research it. So interesting that he was Canadian, that it happened in Canada, and I guess we can blame stress on Canada, I guess. Hopefully not. Anyway, here's what this slide represents. So what we know is that in order to respond to our alarm in the morning, to get up out of bed, to get to work on time, to meet the demands of the day, it requires us to have a certain level of stress such that we can hold our head upright, we can pay attention to this webinar, and we can just get through the day. That's that blue line, the baseline. Now, for most people, should there be a threat or a danger that presents, the black arrow, the stimulus, becomes present such that it activates the stress response. So physiology changes, our system ramps up, it gets ready for the fight, flight, or freeze, it changes our thinking, and we go into this resistant mode, meaning resisting the threat or danger. a heightened level of stress in order to overcome that adversity, and that's the yellow line. Now we go along that yellow line until the threat, the danger, the adversity is gone, and our system resets itself. It's taken a lot of energy to activate that. So we go into this period of refractory recovery or exhaustion where our body restores itself, it recovers, and we're back up the blue line. And for most people that go through this, depending on how long the event is or the level of threat, this can take from a couple of minutes to a couple of hours to get back up to this blue line. Well, the bad news is what we actually know is that while this model is accurate, we know that it doesn't apply to people that work in public safety, healthcare, first responders. And here's why. That the stimulus is the going to work. That in order to do the work, where lives, where the care of others, we need to be highly attuned, highly attentive, highly responsive. You are operating at that yellow line, that level of stress, that elevated level of stress in order to function and perform at work. That when stress or critical incidents or traumatic events or other things happen at work, what happens is you go from the yellow line like a rocket up into the stratosphere towards the title of the slide. And the whole goal is to come back down to the yellow so that you can continue to work, continue to perform, continue to do your job. Now, at the end of your shift, what happens is you go into that period of exhaustion, you go through that recovery, and you come back up to the blue line, one would hope. However, there's a researcher by the name of Kevin Gilmartin. He was a former police officer that went back and became a psychophysiologist. And what he has found in his research in public safety personnel, people that do the work that many of you do that are present today on this webinar, is that it takes a lot of energy to turn this yellow line on and off after each shift. So to conserve energy, people operate at that yellow line for their entire rotation. Once their rotation is over, then they go into this period of exhaustion and this period of recovery. And it takes 4 days. Kevin Gilmartin has found that it takes 4 days to get to the blue line again. Well, think about it. How often do you get 4 days off in a row before you're back to work? Now, here's the other thing. How many people actually disconnect from work? How many people check their emails or get updates on maybe status of what's going on in the unit or maybe even who's died? And so inevitably in healthcare, we find people don't really disconnect from work. So they just continue to hum along at that yellow line. Now I'm going to talk a little bit about what we can do to mitigate some of these aspects of what happens when you're at this heightened level of stress due to the work that you do in order to help it have less impact on you. And we'll come to that in a couple of minutes. Now, as I said to you before, you're operating at this yellow line of heightened level of stress in order to perform at work. And then something happens, something even more stressful happens. And that can be the start of a psychological crisis. And so when there's an elevated level of stress, we see that prior to the crisis, we are largely thought-driven individuals where our feelings come secondary. So we think, therefore we feel. But after a stressful event goes beyond that yellow line, we largely find that emotions take over and it's very difficult to think. So we feel, therefore we don't think. So pre-crisis, we're driven by our thoughts. After the crisis occurs, we're driven by the feelings and it's hard to think. What happens next is our performance starts to be impacted in response to that crisis. So if we follow the slide across from the left side of the slide to the right slide, let me describe it to you. So if we look at that solid black line that's in pre-crisis and we just follow it over, that's a sign that somebody is functioning, they're performing well. Now, the point of impact happens and you can see where there's a decline in their performance such that only through a series of trial and error through the crisis does a person, once the crisis is over, either return back to their pre-crisis level of functioning, be stuck in that decline in performance, or look at number 3, which is that improved level. We actually call that post-traumatic growth, and I'm going to talk about that in just a second. But what we know is the period of time that a person remains in that crisis response where their performance is declining depends on a couple of key factors. The coping strategies that they know to use. The quicker a person accesses their coping strategies to restore that equilibrium and bring back their performance to that level of functioning through using their skills that they've either have and or taught, the time period and the level of performance decline is significantly reduced. Now, if a person has a plan or supports that help them activate their coping, that reduces that level of decline or the length of period that they're in that performance decline, they can actually have an improved level of functioning. And think about it. How many of you work in a situation where there's a couple of people that the more crisis going on, the better their performance? Well, those are some strong indications that those people have what we call post-traumatic growth. That in fact, having gone through this crisis reaction and having learned how to cope with it effectively and get through it has inoculated them against the impact of these types of stresses and has helped them actually improve their performance. It's a real phenomenon. So going through a crisis isn't a bad thing. It's really what you do in response to it that makes the difference. Now, wouldn't it be nice if we look at that point of impact where that red arrow is? Wouldn't it be nice to know in the work setting that you're in, what actually might make individuals or groups of people vulnerable to this crisis reaction? Well, the good news is we actually have that data. We know this for sure. If we put things in place when these things are present, we can actually help people through. So look at these factors that affect this crisis reaction. They cause people to be most vulnerable to this crisis reaction. So something sudden or unexpected happening, that the level of intensity, and this might not just be necessarily patient care, but what if there's a lot of either family and or parental emotions and or demands? So the intensity of the situation doesn't necessarily mean, care-based. Duration, anything that we do for longer that is stressful increases our risk of it causing a crisis reaction. Think about the difference between doing resuscitation and CPR for 5 minutes versus maybe half an hour. Level of loss, the bigger the loss, probably the more stress. And the best analogy that I can give, but think about one that relates to your job and where you work, is difference between a house fire and the Fort McMurray wildfires and the level of loss that those situations would incur. Given that I'm presenting to the Stollery, NICU, PICU, and the Royal Alex, inevitably anything to do with kids that are sick, injured, ill, dying increases the impact and likelihood of a crisis reaction. So inevitably, by working at the Stollery and working with kids, it makes you more vulnerable. It's more stressful. We know that we're not immune from actually coming across and providing care to people that we know. And so having or relating or interacting professionally with those that we know, either friends or relatives, or even coworkers, which is becoming more common, that actually increases the risk of a crisis reaction. The availability of resources, short shifts, short-staffed, short of equipment failure. If you don't have the resources in which to do your job, it can actually increase the stress such that it makes you vulnerable to this crisis reaction. Level of education and training, I'm going to spend a little bit more time talking about this one. We actually know that new hires, new graduates, are often equipped with the skills and the information that they need to do the job. But over and over, what we hear is they've never even been prepared for what they will be exposed to and or witness in their job, especially in healthcare. So we spend a lot of time orienting people to, where to park, where to enter the building, where to put their lunch, where the bathroom is, all those different things. We do a pretty good job of orienting people to the physical location and some of the things they need to do their job. But think about what the impact would be if we also oriented people before they got onto the unit as to what they might be exposed to or witness, or what it really is like to work on the unit by somebody who's actually done it. It actually is shown to prepare people to be able to cope better. So this lack of orientation, training, or even knowledge about what it really is like can actually make people vulnerable. Availability of coping mechanisms. If you were worn out by what's going on in your personal life, then in fact you might come to work and those things that normally don't impact you at all, because your mechanisms of coping are really worn down and almost exhausted, that you might be more vulnerable to those normal day-to-day things, actually making you more vulnerable to a crisis reaction because you're exhausted or worn down. In healthcare, moral conflict is actually pretty common. And moral conflict is when what you do in the nature of your work conflicts with what your beliefs are. We find this when perhaps you're doing something to a patient that causes pain where you believe that the pain is unnecessary to get a better outcome. Maybe you're doing procedures to sustain a life that in your knowledge or experience you don't believe is actually sustainable or viable, and that it's either prolonging suffering and or pain. Now, what's interesting about this is moral conflict is inevitable. It's not to be avoided. But we actually know that workplaces that actually make it okay to talk about the conflicts and not be seen as being insubordinate or challenging, but being okay to say, I know I need to do it, but I'm not okay with doing it, and here's why. And having support for that can actually significantly reduce the impact of these moral conflicts causing a crisis reaction. So there you go. We do know what impacts you at work. And when these things are ready, indicated, wouldn't it be nice to be ready to support people through it or give them the tools to know what to do to get through it? I mentioned organizational stress as well. Well, we know that inevitably the places that we work, without purposely taking action towards it, can cause stress. And this is a research that's done in North America, and it's not industry specific. But we actually know that these are the top organizational type stressors that impacts employees' wellness, psychological well-being. Take a look at the list: heavy workload, role conflict, time pressures, lack of resources, lack of control, lack of social supports and supports from supervisors, a lack of feedback. Sadly, there's a second page. Lack of participation in decision-making, any job where there's a requirement for high degree of emotional empathy. I think that's healthcare. And a lack of sufficient rewards such as money, social, or intrinsic rewards. And it's funny, people don't want more money. That's not what they're saying. What they're saying is they just want recognition, and that can often be stressful when maybe there's wage freezes or negotiations or politics about pay going on. The sense that you're not valued by those rollbacks or those discussions cause stress. That if in social media or formal media, there's some sort of disregard for the work that you do, but those pale in comparison to the number one reward that people are looking for in their work is the intrinsic reward, the thing that you do that makes you feel good about what you do. When that's not present, it actually is more stressful than these other two. Now, in 2018, Nick Carlton and Don McCready, Nick Carlton is from University of Regina, and Don McCready's from down east in Ontario. They looked at sort of some of the organizational stress in Canada, and in no way does this compare. They didn't do a comparison to other places in the world. So it doesn't say that we have these in other places don't. It just says that in a survey, these were actually identified in our workplaces: inconsistent leadership, bureaucratic red tape, dealing with coworkers, feeling that different rules apply to different people, and feeling like you're always having to prove yourself to the organization were rated as the top 5 stresses in an organization that employees feel impact their mental well-being. So all doom and gloom? I hope not. I think that by understanding what stress is, what causes it, now what we can do is really talk about what to do about it. And we're going to move into the section on resistance, resiliency, and recovery. So if the opposite of stress is mental well-being, we actually know the 3 components that contribute to mental well-being are this: resistance, resiliency, and recovery. And we incorporate 4 components that build upon this resistance, resilience, and recovery that aid in reducing these stress reactions. So let's take a look at them. Number 1, education. Know the signs and symptoms of stress. Know what it is and know how it shows up in your body. So I got a little bit of conspiracy I got to admit to, that the first half of this presentation was actually to present you with the education that would actually help you reduce your stress reaction. You actually now have heard what the signs and symptoms of stress are, what it is, why we have it. But now what you're left to do is how do you best respond to it? How do you cope with stress? Once you notice these signs and symptoms, do you know what to do to get through? Well, you've made it through life this far, so you must be doing something right, but maybe there's some things you could also be doing better too. So take a moment and just sort of reflect upon that. The other thing is, where do you go? Who do you talk to? What are your supports? This rapid assessment. When you need support, do you know where to go? Where to talk it out? Assess what's going on. And if 1, 2, and 3 don't work, do you know where to go to get help? Maybe more on a more formal basis. So these 4 components, education, respond, rapid assessment, and rapid treatment, are incorporated and make up this resistance, resiliency, and recovery. And in the research about how, when we look at people that are more resistant and resilient to stress, over about 30 years of research, we found that there's 6 factors that those that are more resistant to stress have, and it protects them. So the first one is they face their fears and they solve their problems. They don't let them build up. That they get some regular physical exercise. And I'm going to go back to what Kevin Gilmartin found in his research about public safety personnel. That, remember I told you that it takes 4 days to go from that yellow line in order to go to the blue line after you're off your rotation or shift? Well, Kevin Gilmartin found that if you do 22 minutes of getting your body in motion every day, or 5 days out of 7, it can reduce that response time, that recovery time, by 80%. You go from 4 days and you reduce it by 80%. It really works. And I don't know about you, but I waste more than 22 minutes a day. People that are optimistic are less stressed than those that are pessimistic. And if you have a strong moral compass that defines who you are and what you're about, you perceive the world as being less stressful. Having social connections, nurturing friendships, and role models actually has a strong supportive factor. Can't understate how important it is to be connected to other people, and it really reduces stress. Those that are open-minded and flexible are less stressed than those that are rigid and dogmatic in their thinking. And it's no surprise. It's not rocket science. But maybe there's 1 or 2 areas that you guys could work on that would help you reduce that impact of what you do by the nature of your work, which is inherently stressful. So what that says is that stress is actually within our control, that resistance and resilience is based on our attitude. And it's not like that teenage, you got to change your attitude type thing. Attitude is actually the information that we take in about what's going on around us or in us, and the meaning that we assign it, or the interpretation. And based on this interpretation or this attitude, we start to see behaviors change in order to cope. And so therefore, what I really want to stress is most of the time we focus on changing the source of our stress. And if we think about the COVID-19 situation, there's not much that we can do right now. Maybe wash our hands, wear our mask, social distance, follow those rules, but we can't make this virus go away overnight. But I bet that if you use some of those 6 factors that were on the previous slide, and if we change our interpretation or meaning of the event, that in fact what we can do is change how we let the stressful situation impact us in 1 or all of those 5 areas: physical, cognitive, emotional, behavioral, or spiritual. Now, in public safety personnel, when you're operating at the red line at work and something stressful happens and you go off into the stratosphere where stress rises and you're at risk for that psychological crisis and that performance decline, we actually have a set suite of tactics that we know work for people that do work like you, such as you do. I'm not going to go over them because, in fact, what they are is they are the basis of what we call critical incident stress management, CISM. And both at the Stollery and the Royal Alex, there are CISM teams and there are peers, and they've been trained in this. They've been trained in a program of specific interventions that has about 35 years of history now, a lot of research that says it works with public safety personnel. There's over 1 million peers trained globally, 4,000 organizations, including the United Nations, use it, and that it's tailor-made for public safety and components for hospital-based staff. It incorporates 6 key components, and let's work from sort of left to right. So first of all, we help people build resiliency, understand what stress is and what to do about it. We do and teach psychological first aid. That's what PFA means, to individuals. So helping them understand when they're impacted by stress and how to get through it as well, one-to-one. If we go top and bottom, we look at sort of an assessment of the impact stress is having and coming up with a plan of action based on the core set of skills that peers have and are trained to deliver effective interventions, either individually or in two different types of group formats. So it's peer-led, it's peer-driven, and the peers are all trained to do the assessment, come up with a plan, use the best intervention based on who needs what when, to follow up to make sure that the intervention was effective. And they're also trained to recognize that when somebody needs more, to know where to link them to, where to hand them over. We actually know that those that receive peer support see a reduction in some of the more dysfunctional aspects or problematic aspects of stress. We see decrease in coping by drinking. We see decrease in symptoms of PTSD, major depression, anxiety. And this global impairment, what we see is we see people are less negatively impacted in their performance having had a CISM peer intervention than if they don't. So we've walked through what stress is, what to do about it, some things that are within your control, and some things that we can do uniquely within workplaces and situations where you are more vulnerable to some of those events like suddenness, intensity, moral conflicts, to help you get through.